Have you been told that letting kids cry it out is the way to go? Today I'm covering what the cry it out method is and why I rarely recommend letting kids cry about anything. I see cry it out, the method, or what we call as behavior analysts, we might refer to as extinction-based approaches. And I see this used in many different areas. Today we will go over the potential downfalls to this approach and what to do instead. So if you've ever wondered if you should be using your therapy provider should be using or considering the cry it out method, make sure you listen to this episode because we certainly will answer the question, is cry it out technique a bad thing or a good thing, and what to do instead. Okay, let's jump right into the cry it out method, and let's specifically talk for a minute about the cry it out method for sleep training. If you've heard of the cry it out method, it's probably related to sleep training babies. The premise is that babies will learn to self-soothe and not rely on sleep dependencies like being rocked or fed or comforted by an adult to go to sleep or to go back to sleep. Essentially, you leave the baby or toddler or even an older child in their room to cry until they stop crying and go to sleep. A 2020 study in the Journal of Child Psychology and Psychiatry found that using the cry it out sleep training method made little difference to a baby's development by 18 months. I do not agree with using this method as it can actually cause a child to be less confident and less trusting, which can lead to crying and other problem behaviors in all areas. Last week, I did a solo show and a book review of Dr. Becky's Good Inside book, and we will link that show in the show notes. But chapter 28 of the Good Inside book, as well as chapter 11 of Turn Autism Around, which is my book, we will link both in the show notes. But both books have sleep chapters and very similar recommendations for gradually fading the parent out of a child's room or bed to have the child get comfortable sleeping alone. And neither of us, Dr. Becky or myself, recommend letting children cry it out, especially for longer than a minute or two at a time. I will say that, kids will cry, especially kids who are on the autism spectrum or have severe speech and language delays. They might cry a little bit more because they don't have the language to tell you exactly what's going on. I don't recommend letting kids cry it out for anything, especially when we're talking about sleep or we're talking about something like that, but really in any environment. So you definitely want to learn more. In addition to chapter 11 of Turn Autism Around, I also have a sleep Kindle ebook, which is only like 25 pages, very brief, very inexpensive, and really gets right to the heart of it. So we will link that in the show notes as well. I believe that during sleep, and we're going to talk about other areas where cry it out is used, but specifically in sleep, I believe in providing supports and interventions that rely on positive reinforcement and an opportunity to slowly change behavior to keep kids as happy as possible with the least amount of stress and to have them in a learning, engaged situation for most of their waking hours. No one is learning any skill, including self-soothing or sleeping, while they're hysterically crying. I usually give this analogy. So pretend I am learning to fly a plane. And I really am not prepared, right? So I go into the cockpit and there are hundreds of different levers, and it's super important because, if I do the wrong thing and start flying the plane, obviously, super overwhelming. The instructor starts showing me these buttons and I start to maybe verbalize like, this is really this is really difficult. I'm not going to be able to do this. Maybe I start crying. Then I start sobbing and hyperventilating. And if at any point, even if I'm whining, telling him it's too hard, telling him I don't understand, or crying and sobbing, and if the instruction continues when I'm not in a ready, eager state to learn, I have completely shut down. And if the instructor keeps going, it's a waste of the instructor's time. It's a waste of my time. No one's learning. I'm not learning to fly a plane while I'm screaming or crying because the task is too hard. So if we use that analogy, if kids are crying, to me, that means the demands are too hard, too high, and or reinforcements too low. And it's usually both. We usually have really high expectations, very low reinforcement. You just need to do it because your older sister sleeps in her own bed. You need to stop crying. Like, especially for kids with autism and or speech delays, it is critically important that we allow them to communicate with us. We soothe them. We have the attachment and the focus on being gentle, being positive, and preventing crying as much as possible. So before I go really into the techniques to prevent crying and the techniques we're going to use instead of the cry it out method, I want to take a look at other areas where cry it out method is used, unfortunately. I see cry it out being used in therapy settings, in schools, in daycares, and in homes for many situations. So I had a course participant. I have online courses. I have one for toddler and preschooler, which is our most popular course. And then we also have a very similar course for school age kids who are still not talking a lot and still struggling in self-care, language, and problem behaviors, regardless of age, for the younger child course and the older child course. But I had a grandmother who took the toddler course, and she had her grandson was 2, and she learned how to pair up these materials, and her little grandson was so adorable. And she got him, happily responding. He was saying new words. And then she came into our online community, and she was so excited because she said, well, we'll just call him Billy. I'm not sure what his name was. Well, Billy got to the top of a wait list for ABA therapy, and they're going to be coming into the parent's home. So I won't be working with him as much. But I am a little worried because they said day 1, they were going to take Billy into the therapy room, which happened to be his bedroom. And we should be expecting a lot of crying on the first few days. And that was the worst thing that I could hear, because the grandmom had spent a couple of months with us, maybe 3 or 4 months. She was having a lot of success. She was pairing herself and the materials and the table and the natural environment. And then all of a sudden, strangers are going to take your child into a room and quote unquote do ABA therapy. And this is the same thing that happened, with Kelsey, who's our community manager, and she's been on the podcast many times, and we can link her story. It was actually podcast number 3, way back, more than 5 years ago. And, Kelsey drove her son an hour away to an ABA clinic, and he had problem behaviors, and he had crying, and he had head banging, and mom was just expected to, well, that's what he will do. I've had participants in our high touch coaching program who have been told by ABA therapists that they can expect these behaviors to take months or years to correct. And meanwhile, with just a few strategies, they were able to put things in place to remediate things quickly. So the moral of the story really is we can do a lot to prevent crying, and it is natural. If you have a good situation going, we should not be like, okay, let's just put him in a room, get him with strangers, get him used to our ways. It's like, this isn't a smooth transition at all. We need the child to be in a calm state, in a happy state, eager to learn, with strong reinforcement, especially when new people are around. We need to think about the child is not learning when they're crying, is learning that they're being basically abandoned when they're crying. And this is very stressful and can be very traumatic to a lot of kids. So sometimes we may have supports in place, and we may have a plan, and we may have very specific time frame where we are taking data to help separate from mom or familiar provider. I had a colleague, for example, who was a behavior analyst and who took my course, and the mom took my course, and the mom stayed with the child at the clinic, and began to transition away. And the child did cry. He cried the first day she left with a lot of supports in place, and they had planned a transition point, and they had taken data. So the first day the child cried for 8 minutes, and then the next day I think it was something like 6 minutes, and the next day it was 4 minutes, and then by the third or fourth day the crying was all done. So that's not the cry it out method. That is systematically baiting out the parent. First she's in there for an hour, then she's giving reinforcement, they're timing his crying, they're comforting him, they're re-engaging him to other tasks that are preferred. Many of our high-touch coaching participants report a lot of separation anxiety when they start, when therapists are arriving in their home and or when they're dropping their children off at daycare. This is usually related to separation anxiety from mom or another parent or a familiar person. Separation anxiety is common in young children. It usually starts to develop between the ages of 6 months to 12 months of age. And it usually does resolve in typically developing kids between 2 and 3 years of age. This is because babies develop a sense of what we call object permanence between 4 and 7 months of age, realizing that things and people exist even when they're out of sight. But they don't understand the concept of time, so they don't know that that person will come back and can become upset by their absence. And also, remember, these ages are for typically developing kids. So you might have a 4-year-old who's only speaking a few words and doesn't understand language well. So they may have severe separation anxiety when a parent leaves. To me, separation anxiety is a pairing issue. We need to pair new people in our home to help care for and work with our kids and gradually fade out the more preferred person. It's usually best to work on separation anxiety at home first. So when a therapist arrives, have them bring a bag of toys and reinforcement. And if they're not allowed, I know some birth to 3 agency people are not allowed to be bringing bags in and out. You could have a bag or a box of super reinforcing items tucked away that the therapist brings out as soon as she arrives. If the child is used to being with the parent most of their waking hours, the process of pairing a new person or environment is going to take a little bit of time. It's going to take more than 15 minutes for 1 or 2 days. So work on that with therapists or babysitters or another person, or even sometimes the spouse needs to be repaired because the one primary caregiver is becoming so reinforcing that it's all about them and their presence or absence. So you may even want to work with, okay, daddy's gonna play a game with you. Mommy's gonna run to the bathroom. I'll be right back. And then you come back. Okay, mommy's gonna run out. And practice trials of you leaving the room, coming back when the other person is doing something really preferred with the child. Also, inside of Dr. Becky's Good Inside book, we have a chapter on separation anxiety, which is really good and written for typically developing kids. So all of these things need some adaptation, usually with kids with language delays and disorders. Another setting is home or therapy, when a child may be throwing a tantrum to avoid doing something, or they want something and you say no. And yes, kids may cry for a little bit, but we want to spend 95% of our time preventing crying. And we don't want kids crying for, 30 minutes, hours on end, saying no to a demand or not giving them alternatives or redirections and trying to calm them down. I do like to use the analogy of that pilot example. If a child is super upset, there's something going on. They are communicating with you. We need to look under the hood, be the Monday morning quarterback to figure out how to get the child calm and how to prevent the crying going forward. So those are some examples, and I've touched on why I don't recommend cry it out technique. But just to summarize, the cry it out method increases stress on the child and families, which can harm relationships and increase crying at other times of the day as the child no longer feels secure. The cry it out method limits learning of the skills needed to actually target an increase of language and reduction of problem behaviors, including crying. The cry it out method fails to build trust, which can lead to issues like severe separation anxiety and aggressive tantrums like we discussed in last week's episode, which we will link in the show notes. And the cry it out method really has unknown brain development effects. I certainly would want a child calm and as happy as possible during most of their waking hours. And I don't see any advantage in letting kids cry it out. But we can't just let kids get away with everything, right? No, I'm not saying that. But the cry it out method, I believe, is potentially harmful in a lot of ways. So what should you do instead? The number one thing you need to do instead is assess the situation. Assess the whole child's situation. I have the BECA, which is the Barbera Early Childhood Assessment. It's a digital assessment. You can find it all in the show notes. It takes about 10 minutes to complete and gives your child scores in adaptive self-care skills such as eating, sleeping, potty training, grooming, dressing. Gives you scores in language and learning skills, and it gives you scores in problem behaviors. So we want to do the BECA assessment. Then we also want to do language samples, ABC data to determine what the trigger is for crying, what part of the sleep routine may be causing the crying and might need to be paired or taught in a different way. We want to pair new people with reinforcement. The therapist, the babysitters in the home, and even your spouse might need to be repaired. Also, when going to a new daycare therapy setting, it is okay to request to stay so you can see the layout and how you might offer suggestions and how they can provide reinforcement and do a gradual fading out. Ensure they are not placing immediate demands but are forming a relationship with the child. For sleep, you can go to Kindle and get the sleep ebook I talked about, and or read the Turn Autism Around book with the sleep chapter has a lot of great techniques, including rubbing the child's back as they're falling asleep, slowly transitioning out of the room while your child is drowsy but not quite asleep. And if the child cries when you leave, start by bringing a chair and move it away from the bed every night until you can slowly fade out. I know it sounds like a lot more work, but in the end, you will build a better relationship and the child will do better without the cry it out method. We want to be proactive in preventing problem behaviors across settings. As you can see, we don't want to use the cried out method, and we want to focus 95% of our time preventing crying. We want to support kids by using assessments and teaching what is needed to prevent crying. Usually, this includes structured engagement throughout the day and reinforcement. We want to be the spoiling grandma as long as things are going well. And when crying does happen, we want to take easy data and try to stop the problem behavior by limiting attention, changing your voice from a sing-songy, happy voice to a calm, neutral voice. Don't use a lot of language which the child won't understand. And once the child is calm, even for a few seconds, we want to clear the slate and then get back to a fun activity where we can start using and reusing a positives to every negative. I hope you enjoyed this episode on the cried out method and the other techniques that I would use instead. If you did love it, I would love if you would share it with others. And if you need more concrete strategies and videos of me showing you what to do with kids with and without autism, I would love if you would attend a free online workshop and consider joining one of our online courses and communities. Thanks so much for listening, and I'll see you right here next time, same place.